I volunteer at Union Gospel Mission Free Clinic. They're a free clinic that offers healthcare to anyone regardless of whether or not they have insurance or whether or not they can pay. The other day I was there and this woman, she had a shoulder injury, and so she kind of stopped using it. It had been like a year that this injury had been going on, and she hadn't really had access to any kind of medical care. She wasn't able to get surgery, she wasn't able to get physical therapy, and so her shoulder had kind of frozen.
The primary cares are really overwhelmed around here. So sometimes patients will call and like the doc's schedules are like fully booked for the next 2 weeks, but they're having this abdominal pain. Those patients that kind of fall through the cracks come to the ER. And sometimes they're people that they haven't had routine exams in several years, and now they're super sick, or they're having all these different kind of organ failures going on, or diseases that have gone undetected or unscreened just because they either haven't been able to get into their physician, or lack of funds, lack of insurance, that kind of thing.
I got diagnosed with cancer, and it kind of really made me think, like, I had to really ask someone to save my life, or else I was going to die. I was supposed to go down to University of Utah, but they refused me because of insurance. So basically one of my friend's dads ended up doing the surgery because he was the most experienced person in the area. Even with or without insurance, there was nobody in the town that really was a cancer specialist, knew how to treat my cancer. Nobody really knew how to do it. You need specialists that only major cities have, and they're few and far between, especially out in the Northwest.
And it is realistic to see other specialists that are far away. I think that's a lot of cases we have to travel out of town to do that. But to have someone there that's close to home, that's able to say, let's make a phone call to a certain specialty, and I'm going to be beside you this whole time. I want to be, my office, my staff are here for you. And I think that's something that was missing when we, growing up.
My husband, he's got diverticulitis. He had a flare-up last year and had to go to the emergency room because this clinic didn't have anything open. All the doctors were filled up.
Running a business is real challenging out of a small town, but it was what my dad could not relocate. And that's the case for a lot of people. It's like their families can't just get up and go if their son has diabetes. Their livelihood is depending on the family's business or what's keeping them in that small town.
I think all of us in the field are pretty painfully aware that there's a huge shortage of physicians, and there are a lot of physicians in the baby boomer generation that are retiring, and the retirement rate is higher than the rate that we're actually matriculating physicians.
The concept of developing a medical school that would be able to help this community and this region create a new generation, and then maybe many generations of physicians to take care of our health needs was just a tremendous motivation.
The mission statement really resonated with me in terms of training physicians to serve in rural and underserved areas. That's why I really wanted to go into medicine in the first place, was to be a provider that provides medical services to people who wouldn't otherwise have access.
Whatever I can take and learn from here, to be able to bring back into those small towns, the small communities, be able to apply it, and that can be the difference maker in somebody's life.
What PNWU is doing is training physicians in such a way that majors on the reasons why we need to take the time. We need to listen to get to the root cause so that our communities are actually getting more healthy.
When people are healthy, they can more positively contribute to their communities.
When we founded the university, we founded a university, not just a college of osteopathic medicine.
We need everything we can possibly bring here in the medical field. There's a shortage in almost every direction you look.
Every program that you can bring in here, every possible future healthcare worker is going to be beneficial for the area. Everybody has such a crucial role, especially in rural healthcare.
That's what I see the additions to the campus doing, is creating that whole medical team model that's really truly a whole patient model.
There's a lot of small towns, especially in the Northwest, that are between cities that, yeah, there are a couple hundred people live there, but those people matter. And we need people to go take care of them.
We never dreamed that in our lifetime we would get the opportunity to help with something this big, this important. I mean, who could imagine that? And to think that we actually got to play a role in getting this thing here is the most satisfying thing in our life. So this campus is just at the beginning. 20 years from now, I predict there'll be multiple schools of training on this campus, most of them medical and medically oriented, and I love it. I'm proud of it. I'm proud of this community.